This is Akashvani Kohima bringing to you a series of episodes titled In Focus, a live interactive program on a Drug Free Nagaland, which is an initiative of the regional news unit Akashvani Kohima in collaboration with the Nagaland Police Department that is broadcasted live every Monday at 1 p.m. which goes on till 2 p.m. It's a bilingual program where you can also be a part of this live interactive program. That is by sending in your feedback, your queries, your questions through SMS. That is by typing your questions, your queries, and sending it to the number 9436805333. As well as you can call and speak directly to the experts who are here in the studio. And for that, you just have to remember the number 0370 224 3036. That's where you can dial in and talk with the experts. And we are also live on Akashvani FM channel, that is 103 megahertz, as well as YouTube live stream at Akashvani Kohima program. And we are also at News on Air app. Good afternoon, listeners. I'm your host, Kenny, and here I am with another episode in this exclusive series In Focus. And today we are going to talk about central and state government's initiative against drug menace with a focus on the ministry's guideline. So to talk about this groundbreaking topic, we have with us a very knowledgeable expert panels. We are joined by Mr. K. Wango Langsym, who is the Deputy Director, Directorate of Social Welfare Nagaland. And as we all know, social welfare is the nodal department. And Mr. Langsym, he is in charge of the drug-related program of the state. So welcome to the studio, sir. Yes, and we also have with us Mr. Bendangmoa, the coordinator, state-level coordinating agency. That's for the states of Arunachal Pradesh and Nagaland Kripa Foundation, Kohima. Hello, sir. Welcome to the studio.
Thank you for inviting me. Thank you so much.
Thank you for being here with us this afternoon. And well, listeners, as we are all aware of the fact that drug menace and alcoholism are suicidal in nature, and hence government is also focusing on these issues. But the question here is how effective as well as proactive are the government's policies and schemes in their fight against this menace? How coordinated are they on this issue at the central as well as at state government's level? Are the NGOs and agencies well funded or sufficiently equipped to narrow down the menace, at least, if not possible, to eradicate it completely? So this afternoon in this episode, we shall discuss and share on implementation of guidelines in the state of Nagaland. And to begin with, drug abuse and alcoholism being a severe social problem, the ministry's guideline based on Article 47 of the Indian Constitution, which provides that the state shall regard the rising of the level of nutrition and the standard of its people and the improvement of public health as among its primary duties. And in particular, the state shall endeavor to bring about prohibition of the consumption, except for medicinal purposes, of intoxicating drinks and of drugs which are injurious to health. So that being said, I am going to start with Mr. Langsym. So Mr. Langsym, can you give us the brief outline of the ministry's guideline?
We know that India is a signatory to the 3 UN conventions, namely Single Convention on Narcotic Drugs 1961, Convention on Psychotropic Substances 1971, and Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substance 1988. Yade tinda convention de sign kura de Article 38 of Single Convention on Narcotic Drugs 1961 aro Article 20 of Convention on Psychotropic Substance 1971 obligates countries for taking all practical measures for the prevention of abuse of drugs and psychotropic substances and for early identification, treatment, education, aftercare, rehabilitation, and social reintegration of the persons involved, and also for promoting the training of personnel involved in these areas. Accordingly, Government of India NDPS Act that is Narcotic Drugs and Psychotropic Substance Act 1985 etu enact korise. Etu kile karne korise kule etu regulations operations etu kan kiba control kobole, especially relating to narcotic drugs and psychotropic substances. Aro etia section 71 of NTPS Act 1985 bra etia ministry brado itu laga hisate tade kol jagate lage tade rehabilitation centers khan nohelaba treatment facilities aro aftercare aro social integration etu kurubole ministry of social justice right to la part way ase. Aro tade government of India has brought out a national policy on narcotic drugs and psychotropic substance 2012 to serve as guide to various departments or ministries. And so our job is demand reduction by creating awareness on the ill effects of substance abuse and by opening rehabilitation centers wherever it is required. So under this we have again National Action Plan for Drug Demand Reduction, that is for the year 2018 to 2025 majode etu National Action Plan for Drug Demand Reduction etu karne tade ministry bra etu kaam kori ase tade bi components alag ase tade State Action Plan for Drug Demand Reduction tade state government bra action plan banai aro ministry bra grant korile etu programs to implement kore aro under that program bi aro the addiction centers na district the addiction centers etu khulibole laga tade provision ase aro edia nasamuk bharat abhiyan koina edia poila first etu few district it agise only last 15 August bra Nagaland division district etu cover korile ministry bra etu kotha.
Thank you so much, sir. Apni man balwa ministries la guideline balwa mohan dekui dia karne. And under the Ministry of Social Justice and Empowerment, Government of India National Action Plan for Drug Demand Reduction, assistant to voluntary organization for prevention of alcoholism and substance abuse, and for social defense service is given. So, is this properly availed?
Nagaland 8 NGOs disina kuntu he ida poila do integrated rehabilitation center for addicts way. Only idia do last few years right to stop ho jaise idia they have changed the nomenclature. Idia do district de addiction centers koira tade Nagaland 8 NGOs pura etu facilities do avail kori idia dak.
Okay.
Aro last year or previous year to funding pattern de BFMS also came in, so a lot challenging lagise only I think aste to pick up hujale funding be smooth huja bola the funding pattern change wa garne a lot challenges to face kori lagise.
Right. Okay, and also scheme of assistance for the prevention of alcoholism and substance abuse and for social defense service is the flagship scheme of the ministry in the field of drug demand reduction. So being a flagship scheme, is this in right earnest in the state? So coming to Mr. Bendangmoa, assistance to voluntary organizations for prevention of alcoholism and drug abuse. The scheme of assistance for the prevention of alcoholism and substance abuse is being implemented for identification, counseling, treatment and rehabilitation of addicts through voluntary and other eligible organizations. So how is your department implementing or enforcing the task of identification, counseling, treatment as well as rehabilitations? Mr. Bendangmoa and Mr. Langsym, both of you can shed light on that.
Okay. Regarding this assistance, we need from the NGO's point of view, Russia Group, like Sir has rightly mentioned, around 8 NGOs come to Korea, or as an SLCA, it is our mandate to assist them in availing the process as well as download ministry load. Coordinate Korina to help Korina. Now, as Sir has rightly mentioned again, due to the policy change of availing the fund, there are so many challenges where some NGOs are having a lot of problem, which is not getting the fund on time because it's a crying need. So that is one big challenges that the NGOs are facing. Though there are a lot of things that can be done where department has pushed certain activities to mobilize it earlier. Sometime from this ministry in Delhi also, there are sometime communication gap. So these are some of the challenges which NGOs are facing. Now, in terms of services providing, we are also mandate for providing trainings to all the NGOs who are in this field, regardless of having a running a treatment center. We provide counseling trainings, management of centers. We used to give short-term training in a sense, 2 days, 3 days, 5 days training at a max. So apart from the funded, there are some NGOs, but like Sir has mentioned, from last year, all the state, district level TDAC lado advertised to Korishe. In Nagaland, they still to be picked up by many NGOs. Apart from Kohima in Dimapur, alak district man NGO actively applying for this drug sector man nahi. So district wise though, the district NGO should take up this schemes.
As a department, our job is to facilitate, so we need vibrant NGOs, and if NGOs come forward to apply for this grant in aid, our job is we scrutinize and then we go for inspection, and if it is ठीक ठाक से बोले, we recommend to the ministry. Identification की करने दो, इटू तो counseling करने दो, इटू NGOs करना तांगे चाबेली.
Okay. Right, so my dear listeners, we are with our discussion here in the series In Focus. That's a live interactive program that's going on right now at Drug Free Nagaland. Our man ajila topic to assist central and state government's initiative against drug menace with a focus on the ministry's guideline. Our man la experts kan be na man la de buhina se studio stay to apnian kiba question hudiole munjaile, kiba doubts, kiba feedback videole munjaile to man de likhi diole pare ho. SMS la get we khulina se number do ase 9436805333 aru likhya time de apnian code to prefix kore apnian la messages de that will be FM space F likhi dia hobe apnian la questions kan aru pathai dibe experts kan ide they will be more than happy to take your messages. All right, so man idu interaction do jari rakhibo but right after a short musical break, so stay tuned with us at Akashvani Kohima.
Yeah, I know it's not easy, but I'll try saying yes. Yes to life and no to things that cut it short, my friend. Life is beautiful and it's a gift for you and me. Yeah, you should know life is worth it. Every time, every moment, I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to life and no to drugs. It's the only way. There's no other way. There's no rewind. Yeah, I know. Sometimes people, they feel low, they need a hero. Falling into drawing deeper, don't have pathway. No to drugs and no to anything, that's a mistake. Yeah, you should know. Just say no, no. Just say no, no. Every day. Choice is yours. I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to love and no to drugs. It's the only way. There's no other way. There's no
Dear listeners, welcome back after the break. You are listening to the series of episode titled In Focus, and that's a Drug Free Nagaland. And in our studio we still have the experts with us, so let's continue with our discussion, Central and State Government's Initiative Against Drug Menace, with a focus on the Ministry's guideline. So under the scheme, as we were talking earlier before the break, financial assistance up to 90% of the approved expenditure is given to the voluntary organizations and other eligible agencies for setting up or running integrated rehabilitation centers for addicts, that is IRCAs, as well as regional resource and training centers, RRTCs, for holding awareness come de-addiction camps, ACDC, as well as workplace prevention programs, and so on and so forth. So in the case of northeastern states, Sikkim and Jammu and Kashmir, the quantum of assistance is 95% of the total admissible expenditure, right? So the balance is to be borne by the implementing agency. Could you kindly elaborate on this?
Okay, actually many programs related to drug sector is actually 100%. When it comes to NGO, 90% is given by the ministry and 10% is to be borne by the implementing agency, that is the NGOs. So as of now we follow that, but as far as other programs are concerned, it's 100%.
Yeah, see, from what we understood of regarding the policy of the ministry is that when an NGO apply for any scheme under the ministry, they look for the maturity of the NGO, at least 2 years. So they are looking at the expertise or kind of how dedicated and how they are working in this area. Now looking at the 90 or 95%, unfortunately 95 is our grant which has been given to the Northeast. They want us to take the ownership. That is also one point, because most of the time 100% means 100%, but if contribution comes in, certain ownership is given, and then the responsibility of the NGOs also comes in. So that is also one understanding which the NGOs are implementing. And in terms of the Regional Resource and Training Center, now for the last 3 years, the nomenclature has been changed to State Level Coordinating Agency. So Kohima based, we are looking after Arunachal Pradesh and Nagaland. So these are two states. Earlier it was Meghalaya included, but now in Northeast we have 4 this SLCAs, where Manipur is one, Mizoram is covering Tripura, Nagaland is covering Arunachal and Nagaland, and Assam is covering Assam and Meghalaya. So those are the area centers where similar grant is given. Sometime for SLCA it's more of 100% for the grant. And for the training sector, since we are the one who is implementing the awareness program or trainings or research, it's 100% from the ministry.
So on the question of financial assistance in the field of social defense, this scheme is called General Grant in Aid Program for Financial Assistance in the field of social defense, with the aim to meet urgent needs failing within the mandate of the ministry, which cannot be met under its regular schemes. So to support such initiative of an innovative pilot nature in the area of welfare as well as empowerment of the ministry's target groups with financial assistance, given up to 90% of the approval expenditure to the voluntary and other eligible organizations. And in case of an organization working in a relatively new area where both voluntary and government effort is very limited, but the need for the service is very great, then the government may bear up to 100% of the cost. So how is your department going on about with it?
As far as NIST is concerned, we have a state level coordinating agency in Nagaland, that is Kripa Foundation. And then anything to do with the NIST is done by the Kripa. So we don't have direct link with the NIST. So NIST programs are being implemented by SLCA in Nagaland. But the Department of Social Welfare, we have collaborated and organized quite a few programs, and we also have programs upcoming programs to be implemented in collaboration with the Kripa Foundation.
Yes, in this area, the innovative part or the kind of implementing the program. For if we look back at the earlier mentioned National Action Plan, now as of now we are also in discussion with the National Institute of Social Defense. It's an autonomous body under the Ministry of Social Justice. So they are the responsible for implementing this. So tagan ki bhi koi ase tagan bhi koi dagi ko will be. I think there need to have a look back on the action plan. Klimane those action plan which is applicable in the eastern part of India cannot be applicable in northeast region. Similarly, southern part of India truck train is different, and northern part of India truck train is different. So the implementing also is different. For example, in one mainland India, kiba ekta street play goribo golido, they can do it. There are certain places, so they can campaign like that. But here, street play is not valued in that much. Among the ekta college institution or with certain village councils, see. So the approach are totally different from the other region of the country. So we are also insisting, we are also giving the suggestion, action plan so hopefully the ministry will look into it to not one size fits all, but the program has to be something diverse so that it fits the region and it is effectively implemented as per the regional requirement. And then another thing is when we are talking about treatment centers, that's a fixed treatment centers, residential centers as so itokando now ministry is giving 1 month free treatment dibigona grant to diaje the chronic need kwa when we talk about this general chronic need program financial assistance. But if we look at the effectiveness of the program, that means treatment already highly 1 month is not effective. Many a time it's very complex. Certain people might get recovered after 1 month treatment, no doubt. But in general, more successful is 3 month period. It is universally accepted where 12 steps programs are followed in many centers. The ministry also has to look into it where tadi ikta give and take to reach out, and they have to reach down and work on this, set together, and then itia 1 month lagado assistance can be kini or na changes or how we can improvise it. Ito laga di olop, ito can be treatment sector, ito laga financial assistance will be only even program planning laga, not only for 1 month. There needs to have a look because 1 month is not that much effective most of the time. Running the IRCA, as we call it in short, treatment centers kolido, there is a guideline called minimum standard of care. So it was published in the year 2009. To Itiado, there are a lot of needs to be changes because Itiado, it's 2024. I was told it is in the process and we look forward that it will be revised very soon. And that is something which we look forward for the improving the services. We as a service provider, we need a certain proper guideline. We look forward to it.
All right. As per the guidelines, the addiction centers are to be set up in each district's headquarters. So how far has Nagaland succeeded in this task?
Ministry notun irgado nukola hoise, but then they have changed it to district de-addiction center. Tade ekbardo Mon district gap district karne hola hoise.
Okay.
Tade mokhan ekta naparado काम कुरा खान जो बेसी ऐसे NGOs खान ना होले भी इतिया grant initi apply करूले दो ताते criteria बेसी ऐसे papers बेसी produce हो लगे इटू जगह दे नपुंजा बेसी हो जाए इटू करने मोंदी भी बेसी try करी ना last day चकवा when एक ता NGO ऐसे ताकन ब्राहे एक ता करी से होले भी ताकन भी paperworks थोड़ा टिकता रही ना funding दो हिले इतिया भी smooth होने इटू बेसी दे ministry ब्रा Nota district to namely Chomokidima, Kipri, Mokokchung, Newland, Noklak, Jiminyu, Toensang, Wokha, Zenibodo. It will know that district to Aru Gap district karne declare krise. Means that they Irgana Dhaka Jagade, the addiction center Kulu Pare. So it will district know that they be the addiction center Kulu Pare Gwina application to invite krise. That they Etu karne district administration bra saigana ekta criteria to ki ase 4,000 square feet na etu khor do rent free dibo lage ministry
Okay.
aru enaga la criteria thaka bra khor paole tiktar bi bisi ase enaga koina challenges bisi thaka bra opportunity to avail guru na para ekta ase so last year we have received application from Wokha district
Okay.
only be alag district de itia ta bi itu laga facilities to avail guru na para ina ase
Yeah, Dadi ekta very challenging, like comparatively. Let's just compare with other state also. And forget about Northeast. Ekta mainland jale NGOs who are running the centers, they receive CSR also. So they used to run, and since they have strong resources, government be 8 p low, will be mobilized for pare. Where I meant to say is that infrastructure are nasidan. Without the CSR funding, they have already have an infrastructure, so they can go for the TDAC or the run go paru chance be as here we don't have any CSR in that area. The NGOs to dedicate korna moyan la jaga de itu koribuli monase korna tuk pa laga tikikina ahibo pare holibi itia wanisina resources infrastructure nadagile do ministry laga guideline di qualifying hobo or apply korna paribo. So those are some of the feedbacks we used to receive. Like I've mentioned, they always come to us for applying and all. There is a portal called e-anudan.
Okay.
So NGOs who are registered, you should be a registered NGO or a trust. Moreover, Niti Aayog to be registered hobo lagi na. Itu tuita hoishi gule takan laga financial itu audited piece hobo. To itu kan documents idia serwan sina documentation to pishi lagi, so that we can apply. To takan we always try to help them, even if they are sitting in different district. One office di bohina we try to upload your documents. Like one sina as we go on certain loopholes to like jai. So that's the system as of now. But some NGOs are doing good. Yeah.
aru ekta challenge to the funding pattern be agete koanis na poila do ministry bra advance dibo aru ina kori thake holibi itia do ministry la funding be pura reimbursement mode te ase
Yes, yes.
etu garne tahan at the end of financial year he tahan dibo ek sal pura khatam hoba jore di etu majote sustain grow paribole laga NGOs hobo lage to NGOs ekta do le financially be sound thakibo lage etu criteria be etu ekta ase etu garne besibak NGOs to financially stable na thaka NGOs kan bi thake etu garne kono cholai thaka kan bi ase bhal bra olibi kono center ge jagna sahaduile etu sustain gula diktar ba etu kan bi bai aru dusra jaga nisna especially remote places de kwa nisna thakya manu khan bra ahigna modot khuri dibo etu bi iman nai etu garne charity kam gurina sa manu khan bi free will donation dia manu khan bi iman nai etu bra kundu NGOs bra kundu voluntary organization bra etu cholai ase ta khane bisi dok pai kana credit pagi bisarina enanga to pa khan bi dikhi pai.
Right. So, apni dijin la personal opinion there, how effective as well as proactive is the government's policies and schemes in the fight against this menace, the drug menace? Are there sufficient individuals and NGOs in Nagaland in the battle against or prevention against the menace? But if you can, yeah.
Right now, from NGO's perspective, first point is government of Nagaland should take a proactive role. Kilemani itia drug trend, if you look at the data of research done by the Minister of Social Justice, it was done in 2018. Itia itu BGT this national action plan to implement korna hai ase. Now it's 2025, and after COVID, drastically the drug trend has changed in Nagaland. So it's a very concerning situation. Aro it has also touched down not only to the gender of male but female, or even to the level of high school. So state government laga role itia kuta to koise sob mano department hobi or top officials bi hobi, NGOs hobi, or if you look at, since it's a Nagaland is a faith-based dominated state, it won't be active role try to go. We need to have a synergical approach to this. Kilimani proactive role to political world is difficult. So we hope that government of Nagaland should take a proactive role to look into this. Nagaland drug policy it's in a process. Department is pushing its best. So again, mata di takakan ulap mundile, it will be easily hobli labi ekta ase itu bi ekta mondi ni itu taka ekta share kuri ase aru gwan nishina apart from the ministries plan tadi do takan do national level di kuri ase le amagan bi Nagaland dibi we need to do some research if there is no research done in our Nagaland context it's difficult to implement any program also kule research based program le itu laga effective itu ase district level bi holi bi or target group holi bi there are so many things we can do based on the research only so in broader sense ekta research which need to be done because if we compare I'll just always compare with other states also even other northeast states are also taking initiative as such so Nagaland is high time
okay Nagaland de mokan 2016 de ekta policy thagise itu policy to the Nagaland State Drug Abuse Prevention and Treatment Policy 2016 goina na aru tade sadu napungja nisna enaga ekta paise itu garne the department set with the stakeholders aru we had a discussion on this policy when we felt that itu lot amendment kurina alag Nagaland dibi alag departments kan na even to the extent of skill development especially rehabilitation koile do skill development has to come in aru alag na bank kan bi they have to come in where itu recovered addicts kan logode rehabilitated kule it was so bhavna korabra we have obtained administrative approval from the government and then we have amended that and that is under submission and once the state government kide I do amend kurbo itu so department can be that at least ekta role do loina that they can take part in this rehabilitation process it will name can be to roki ase.
Right, so Social Welfare Department, being the nodal department for dealing with drug menace, have the department done enough to make the public aware of the ministry's guideline and how to apply for such schemes, if you can let the listeners know?
One is the NGO's part is different, that is clear guideline is it? But then the department also have, we have state action plan for drug demand reduction. Under that, we organize various programs targeting various categories of people like youth kan ase students kan ase or stakeholders kan ase tahan ke awareness program koina mohan etu program ina organize kori aro idia especially awareness program de moi ekta kotha koman chadu even schools and colleges na institution can be we are targeting that they also have a big role to play here especially college kan na tahan accreditation time de tahan modot pi pabo kila mane if the institution can come forward and apply for grant in aid from the ministry there's a provision to give grant in aid so the institutions or colleges can take up that program and then conduct awareness programs using various platforms. Idia mogan Nagaland State Action Plan for Drug Demand Reduction there. It's been 2 years I think since we didn't get any fund. Only mogan ekbar COVID time there fund baden there mogan we made use of the webinar with church leaders kan youth leaders kan Arunachal institutions and we have carried out the awareness program extensively and etia bi mogan ki pari ase etu program jole mogan kori ase this year bi state level bra mogan ge our target was to create awareness for those especially observation home children home la ka change etu awareness kuribole la etu thakise assignment so we have carried out that program
similarly itu department laga as a nodal department mokan bi do as an SLCA collaborative effort day recently we organized 2 programs with the Anganwadi workers. Why we target Anganwadi workers is because takando grassroots workers as and drug happening even in rural areas or the families of rural people have their children in urban areas doing the studies. So idu kan nishina sop tigina idu Anganwadi kan logot pi program gurili do information dile ido effective hona gi gona ido as a nodal department logot SLCA is organizing collaboratively aro ido police kan lot bi we have organized with the Commissionerate of Nagaland Police in Dimapur with the inspectors, sub-inspectors, havaldars, so that takan laga awareness bi takile they could be able to help India level in cooperating with their duties. Itu kan nisina mohan itu initiative lah. So department and the NGOs we are collaborating as much as possible so that it is not an isolated job but a coordinated and effective hopefully laga. That's how we have been doing so far, but we have lot more to do if we come out with so many innovative ways that can be implemented, and there is always the sky's the limit for that planning and all.
So norms for setting up of a 15-bedded integrated rehabilitation center for addicts, that is IRCA, itula opor develop kuido parbo.
Acha itu norms too, like I've mentioned earlier, itu ministry la guideline dido kwanishina 2 years they should be matured enough, registered society hobo lagi, and it should be registered under Niti Aayog, that is mandatory, aro their audited account tik hobo lagi, and the present center should be up and running. So itula part ido department bra district administration and the social welfare department takan bra recommend korina IC golido it will be processed through the department. That's the part of NGOs which our role comes in.
Right. So why does talking about the northeastern states in general and in particular Nagaland, why does Nagaland has so many few NGOs as compared to other states, and what can we do about it to improve that?
We have agade moi ata NGOs as we have again some more NGOs. Itu ministry laga grant unit power to they don't fulfill the criteria. Already they are also working. Itu karne itu kan gitu state level bra. All of na depending on the resources available with us, we give annually. Kuna ke 1 lakh, kuna 1,50,000 day. Itu kan melaile to ine 15 NGOs nisna to thakibo. Already my experience dealing with NGOs is काम करा तो busy as re. There are quite a number of NGOs doing excellent work. Only be record maintenance there, our paperwork te kom dia as. We Nagas don't put it in the paper, na? Itu bara ida criteria to keep bara olai. Paper stick thakile to that criteria to that fulfill korbo lage. Only be काम तो busy करे as. Only be itu paperwork te to translate koro na para NGOs can busy as. Itu karne we felt that itu line there NGOs hange we have been motivating aro tange we have to continue to motivate them aro agide SLCA representative Ravi koise that they are also helping out, they are also trying their best to mentor the NGOs from district level also. Itu karne itu kam to parata kure ase time ahal hote itu kan be changes to ahi jabo guna bhavna kure ase dia paperwork to be important ase. तो मिनिस्ट्री दे लो जाले दो पेपरवर्क ठीक नहले तो काम नहोय ना ये तो इम्प्लीमेंटेशन तो बेसी ভাল काम करे देबे ताते ता चला दे मोहन और encourage को लगे NGOs and
one instance when NGOs face this is also one thing. No doubt documentation is very poor, but again getting a qualified person for documentation is also an issue for many NGOs, because like we have mentioned earlier, resources is kom dia se qualified person ho lagi, not a Tom, Take and Harry can maintain an NGO documentation. To either time they one tang low salary divo na bara, idia kran on time na balaga. It affects the sustainability of the employees. So it is also a big issue. So department coalition at state level department brother kimantak paribo. Few lakhs divo, that is hardly for 1 or 2 months maybe. To run a center with a proper, it also actually though, the grant from the ministry should be on time. That is number one. It should be on time. Even if it's an installment, they used to pay an installment. So it should be on time. That is my earnest request to the ministry, that they are trying their best, we know. But again, in the context of our state, like there is no CSR, there is no assistance from any source. We totally depends on the grant in aid. So centers they want to provide the services, but kwan isina qualified person sustain go though it affects the overall scenario of the treatment services. It was here.
Right. Well, listeners, kan najani na time do khodom ase man lahate itia 20 minute hai bachina ase to Julie right ta chutu break la ho man aro it break pichide aro vapas aina time thagyan man la experts kan la de kotha kwa ho man aji topic to ase central and state governments la initiative against drug menace la upore kotha kwa ase aro we are with a focus on ministries la guideline kan upore bi kotha kwa ase to jurina thagibi man la de Akashvani Kohima 103 megahertz de.
Yeah, I know it's not easy, but I'll try saying yes. Yes to life and no to things that cut it short, my friend. Life is beautiful and it's a gift for you and me. Yeah, you should know life is worth it. Every time, every moment, I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to life and no to drugs. It's the only way. There's no other way. There's no rewind. Yeah, I know. Sometimes people, they feel low, they need a hero. Falling into drawing deeper, don't have pathway. No to drugs and no to anything, that's a mistake. Yeah, you should know. Just say no, no. Just say no, no. Every day. Choice is yours. I choose life. It's a happy choice. Say yes with me. I'm here for you. Say yes to life and no to drugs. It's the only way. There's no other way. There's no
And welcome back to the studio, listeners. This is Akashvani Kohima. We are still on our series in focus at Drug Free Nagaland here with the two experts in the studio, and with just 10 minutes in our hand, let me quickly have some more interactions with them. So, as we are all aware that, through the ministry's guideline, every district is supposed to have a district de-addiction center, more like a hospital with 15 bedded, 30 bedded, and 50 bedded. So, with the increasement of that, there is also an increasement in employment. So, how are we supposed to go about that, if you can shed a light on that?
Agite one is na India department bra ministry bra at no that district to ele gap district karne declare guna ase that bra we have received only from few districts. Aro etu loi jabo karne to we need a very proactive district administration, especially DC being the chairman. Tai ekdam proactive role tai play kor lage. Aro tade district administration can run this district de-addiction centers. Our district administration pra na chalawo koile bi tade dedicated NGOs jun tu bra edu criteria ki ase edu sob fulfill korina thaka edu NGOs lage. Aro main du ki ase koile free rent free accommodation na tan edu accommodation do diwo paro lage. Ena hoile district de-addiction center to hile kholibo paribo. Ko age de laga speaker bra kwan to process to hile online ase. One has to log into anudan tade bra procedures to enaga jabo. Once the ministry approve tade inspection karne ahaden de tahan ki to tade fill up korise etu sob to hile physically etu thakibo lage. Bisi bak de magan na thaka bi likhina korila try kura kan bi ase noile oli bi ahaten de edu na pahaten de tade diktar ho jay. Edu karne proactive district administration and dedicated NGOs is required in the district to run these district de-addiction centers. Edu bhal bra chalao parise kole to ek kisam de employment opportunities bi tade ase. Edu kuno manu do le tade bi employed korina pet palibo paru.
Yeah, looking at the employment perspective, it will not only the educated qualified, but it will really help the recovering people. Kilimani, someone who has gone through the treatment, most of them are dropouts or unemployed. So again, one good thing about this treatment system process, the cycle of drug de-addiction treatment center is that recovery people understand the one who is under treatment. So there is an unspoken language which they understand each other, and it is more effective. If centers are open, then recovery people most of the time they can recover on olawo, they become idle and they relapse. Though employment if they are getting engaged, it will really help them. Number two is recovery people need support. They cannot just survive on their own. One of the greatest fear of the recovery people when they come out of the treatment center is I'm going back to that same environment. So vulnerable lagi tahan. So if they come out and do a job in the similar treatment centers, then every day they used to say 1 day at a time. They survive 1 day at a time. It will really help them a lot in maintaining their sobriety, and at the same time could be able to help someone. To Manwan Garnibi, they become a role model. At the same time, they are giving back to the society. So, having more centers, getting more employment, and moreover, treatment centers, you don't need high qualified people also. Experience matters. Apart from the doctors, no doubt, applied psychologists and all, counselors can do. There are always a way to train them if a recovered people with the talent comes out. So, it will really help in lots of employment sectors also.
Ministry, brother. Every district hospital, they want to make it into addiction treatment facilities. Addiction treatment facilities. India, Monday to started inaugurate recent or started recent. Soft district there, it will lose our ministry program to act as. Aro, bisi prison there ahan, be drug related cases ta ahan bisi ase. Etu karne the department felt that prison setting to be related offenders and victims and kuna dole petty thieves kuna petty crime kurabra jail thurina haido tahan gibi like any other prisoner rakilo no, they should be given some extra care. Now ministry have approved for Dimapur and Mon. Only we are also pushing for some more districts where this can be taken up. Aro etia addiction bra effect hoa du khali motakan no hai. Maiki khan bhi ase. Only maiki khan karne hai etu rehabilitation center na. Department has written to the ministry. Last time we the Minister of State for Social Justice I say to them the director or secretary can lock by na or reiterate police Charlie side be na na etu no ina aro many young boys can be school going children tahan bi etu victim hoina ase to tahan bi sabo lage etu karne exclusively for boys etu bi tahan rehabilitation center to kori dibi na mohan ministry ka likina ase and once etu ministry by to grant kori dile bi ekta bhal hobo koina etu bhavna ase.
Alright, so na janina time do khatom ho jase mo la hatte bachina se khali 3 minute to program says na kore agire sir apni decision any last word for the listeners.
Okay, ekta challenges to Naga is a closely knitted society na tate eta mokala department la role to hele demand reduction as supply reduction kore la department be alake interest kore na ase kon is na closely knitted society hobra etu offender bi na trafficker bi khandan manu hoikina thake ki nokora laga situation bi ekta ai jai hoile bi to aru victim bi to hele relative manu hoikina thake to nechola pacha nechola khandan manu hoikina thake tade mohan wisely na ekta trafficker thakle to police ke report kobo lage by reporting mohan etu trafficker ko bi motot kora ase in a way bisi biya no hoi jagide aro bisi society ke bisi biya no kora gide tai report kobo lage police ke koina tai ena content kuri dile bhal hobo aro kon is na addiction bi bemar ekta nisna ase jun to hele addict already addict hoina ase tahan bi as an organization as an individual as a community mohan tahange stigmatize no hegna tahange modot pulala rasta mohan pisare bolage.
Our society lagadi ahibo we have talked a lot about the ministry schemes or the state government's roles, but at the end of the day one advantage we have is Amman society is very strong. We have a strong society unlike other states. So in our Shilidu, we should take the advantage of this strong network as a society or the organization or for that matter the faith-based organizations. Itugan bra amagan role do initiative ikta logina without waiting for the ministries or without waiting for the state government. Idu denial bra law lagi number 1. Or as a disease, it's just a recognition. It's a disease. So as part of disease, without discrimination, without any other thing, itu hands-on growina initiative loya se dia, but still in the initial stage. So more initiative should be taken up by the society.
Well, yes, indeed. Drug addiction has become one of the plague of our times, a serious hazard which threatens public health as well as human behaviors whose consequences spread to crime as well as lawlessness. The challenges are ongoing, but so are the efforts to deal with them. And on that note, let me thank our guest, Mr. K. Wango Langsym, the Deputy Director of Social Welfare, Directorate of Social Welfare, who is also in charge of the drug-related programs of the state. Thank you so much, sir, for making the time and coming here in the studio. And also thank you so much, Mr. Bendangmoa, Coordinator, State-Level Coordinating Agency for the states of Arunachal Pradesh and Nagaland Kripa Foundation, Kohima. Thank you, sir. Thank you so much.
Thank you for having us.
So, dear listeners, with that, we have come to the end of our series of episodes titled In Focus at Drug Free Nagaland, which happens every Monday, 1 to 2 p.m. Stay tuned with us. Join in next Monday again. This has been your host, Kenny, wishing you all to have a pleasant evening.